Today, we're talking about something incredibly important: skin health and its connection to diabetes. For people with diabetes, paying attention to skin changes isn't just about appearance. It's a crucial part of managing overall health. Certain skin conditions can be early warning signs of diabetes, while others appear when the disease has progressed. Recognizing these signs early on can make a big difference, allowing for timely management and preventing complications. In this video, we'll explore 11 common skin signs that are often linked to diabetes. Understanding these can help you or someone you know spot early changes, which might lead to quicker action and better health outcomes. If you find this video helpful, please don't forget to like, subscribe, and share it. This information could be just what someone else needs to see. Let's dive right in. Monitoring skin health is essential, especially for people with diabetes. Regular skin checks allow you to catch early signs of complications that could otherwise go unnoticed. For diabetics, seemingly small skin changes can sometimes indicate deeper issues, such as poor blood sugar control or a heightened risk of infection. By making regular checks part of your routine, you can stay ahead of potential problems and seek treatment before they escalate. Ignoring these skin symptoms can carry serious risks. Unaddressed skin conditions can worsen over time, potentially leading to infections that are harder to treat, especially when blood sugar levels are high. Left unchecked, these infections may spread, making recovery more difficult and putting a strain on overall health. Skin symptoms can also be a critical signal that blood sugar levels aren't properly managed. Addressing these changes promptly not only protects your skin, but can help keep blood sugar in check, supporting a healthier life with diabetes. Sign number 1. Dry and itchy skin. Dry and itchy skin is a common issue for people with diabetes. High blood sugar can cause the body to lose fluids, leading to skin that's dry, tight, and sometimes even flaky. This dryness often causes itchiness, which can feel particularly uncomfortable and may affect areas like the elbows, knees, and feet. If you're experiencing these symptoms, there are a few easy adjustments that can help. Try keeping showers shorter and use cooler water, as hot water can strip even more moisture from your skin. Right after bathing, apply a rich, fragrance-free moisturizer to lock in hydration. And don't forget to drink plenty of water throughout the day to help your skin stay hydrated from within. However, if you notice persistent dryness or itchiness that doesn't improve with these changes, it may be a sign to see your doctor. Chronic skin issues like these can sometimes indicate that blood sugar levels are harder to control, so checking in with a healthcare provider is always a good idea. Sign number 2. Necrobiosis lipoidica. Necrobiosis lipoidica is a skin condition that sometimes develops in people with diabetes, whether they're insulin dependent or not. It appears as yellowish-brown patches, often on the lower legs, that can be tender or even painful. In some cases, you might notice visible blood vessels beneath the affected skin, giving it a somewhat shiny appearance. Although it's relatively rare, this condition is more common in those with diabetes and sometimes in individuals with autoimmune conditions like celiac disease. If you suspect you have necrobiosis lipoidica, it's important to consult a doctor. Early intervention can make a difference, and they may recommend treatments like topical creams or corticosteroids to help reduce inflammation and improve appearance. While the patches might not always be painful, they can worsen if left untreated, potentially increasing the risk of sores or infections in these areas. Managing your blood sugar and maintaining overall skin health can also support better outcomes, so regular checkups and early treatment are key. Sign number 3. Dark patches. Dark patches on the skin, known as acanthosis nigricans, can be a visible sign of insulin resistance. These patches often appear in areas where the skin folds, such as the neck, armpits, and groin, and have a distinct velvety texture with a darker pigmentation. While they may seem harmless at first glance, they're often an indication that the body isn't using insulin as efficiently as it should, which is commonly seen in people at risk of diabetes. Certain risk factors, such as a higher body weight or a family history of insulin resistance, can make someone more prone to developing these dark patches. If you notice these changes, it's a good idea to consult a healthcare provider, as they may suggest checking your blood sugar levels. Detecting insulin resistance early on is helpful, as it can prompt changes in diet, exercise, or treatment to improve insulin sensitivity and overall health. Sign number 4: diabetic ulcers. Diabetic ulcers are open sores or wounds that heal very slowly, commonly appearing on the feet. These ulcers develop due to poor blood circulation and can be a serious complication for people with diabetes, particularly those who experience neuropathy or nerve damage, which reduces sensation in the feet. Symptoms of diabetic ulcers often include pain, redness, and swelling around the wound, though some people may not feel pain if nerve damage is advanced. Several risk factors increase the likelihood of developing diabetic ulcers, including prolonged diabetes, poor blood flow, and nerve damage that makes it easy to overlook minor injuries. Early medical attention is essential if you notice a slow healing sore, as diabetic ulcers can worsen if left untreated, potentially leading to infection or even more severe complications. A healthcare provider can guide wound care and may recommend treatments to promote healing and prevent further issues, making regular foot checks and prompt care a crucial part of diabetes management. Sign number 5: digital sclerosis. Digital sclerosis is a condition that causes the skin on the hands and feet to thicken, leading to stiffness and difficulty moving the joints. This thickened skin can sometimes crack, making it not only uncomfortable, but also limiting in terms of mobility. The condition may start in the fingers or toes and can eventually spread up the arms or legs, making everyday tasks more challenging. The symptoms of digital sclerosis include tight, stiff skin that may become dry and cracked. The skin feels less flexible, and the joints can become harder to move due to the thickening. If you notice these signs, it's important to consult a doctor. Joint stiffness combined with skin tightening can indicate that diabetes is not well controlled, and early medical attention is needed to manage the condition. Treatment options may include topical creams to improve skin flexibility, but addressing blood sugar levels is crucial to prevent further progression of the condition. Regular checkups and proactive care can help manage and reduce symptoms. Sign number 6: diabetic blisters. Diabetic blisters are fluid-filled bumps that can appear spontaneously, often in individuals with prolonged diabetes. These blisters typically form on the hands, feet, or legs and may appear in clusters. They are not caused by an injury, but rather by high blood sugar levels that can affect the skin's ability to heal properly, leading to the formation of these blisters. The symptoms of diabetic blisters include clear, fluid-filled blisters that are usually painless, though they can become painful if they break open. It's essential to treat these blisters with care to avoid infection. If you develop diabetic blisters, it's important to seek medical attention right away. A healthcare provider can guide you on how to properly clean and protect the blisters to reduce the risk of infection. Proper care involves keeping the area clean, using sterile bandages if needed, and monitoring the blisters closely for any signs of infection. Managing blood sugar levels is key to preventing these blisters from reoccurring. Sign number 7: skin tag. Ichim. Skin tags are small, fleshy growths that often appear on the skin, and they are more common in people with diabetes. These growths are typically caused by high insulin levels, which can stimulate the growth of extra skin cells. Skin tags usually develop in areas where the skin folds, such as the neck, armpits, or eyelids, and they tend to be soft, raised, and small in size. While skin tags are generally harmless, they can be bothersome or unsightly. It's important to keep an eye on them, especially if they grow rapidly or change in appearance. Though they are not a direct threat, the presence of skin tags can sometimes signal that insulin levels are higher than normal, which may be a sign of insulin resistance or poorly controlled diabetes. If you notice new or unusual skin tags, it's a good idea to consult a doctor. They can determine if the skin tags are harmless or if they may be related to other health issues that require attention. Sign number 8. Xanthelasma. Xanthelasma refers to small, yellowish bumps that appear on the eyelids, typically around the upper or lower eyelids. These bumps are caused by the buildup of cholesterol underneath the skin, and while they're not usually painful, they can be an aesthetic concern. Xanthelasma is often linked with poorly controlled diabetes, as high blood sugar can affect cholesterol levels, making it more likely for these deposits to form. The presence of xanthelasma can signal that cholesterol levels may be elevated, which is a risk factor for heart disease. If you notice yellowish bumps around your eyelids, it's important to consult a doctor. They can help assess your cholesterol levels and determine if there are any underlying health issues, such as poorly managed diabetes, that need to be addressed. In some cases, if the bumps are bothersome or cause vision problems, they may be surgically removed. However, managing blood sugar levels and cholesterol through lifestyle changes or medication is key to preventing further issues. Sign number 9. Diabetic dermopathy. Diabetic dermopathy is a skin condition that commonly occurs in people with diabetes, particularly those with poorly controlled blood sugar levels. It is caused by changes in the small blood vessels that supply the skin, leading to the formation of light brown, scaly patches. These patches typically appear on the legs, feet, and occasionally other areas of the body. While diabetic dermopathy is generally harmless and doesn't cause pain, it can be a visible sign that blood sugar levels are not well managed. The patches may vary in size and shape, but usually don't cause any discomfort. However, it's important to monitor them and ensure that blood sugar is kept under control to prevent further skin changes or complications. Although treatment isn't usually required for diabetic dermopathy itself, maintaining good diabetes management through diet, exercise, and medication is crucial for preventing other skin conditions and health issues from developing. If you notice an increase in patches or changes in their appearance, consulting a healthcare provider is recommended. Sign number 10. Rashes and skin infection. Rashes and skin infections are common issues for people with diabetes, often triggered by high blood sugar levels. When blood sugar is poorly controlled, the skin can become dry and cracked, which makes it more vulnerable to bacterial or fungal infections. These infections often present as red, itchy rashes, scaly patches, or blisters, and they can appear in areas like between the toes, around toenails, or even on the scalp. To prevent these skin issues, it's important to keep your skin clean and well hydrated. Regularly moisturizing and paying attention to areas prone to dryness or irritation can help reduce the risk of infections. Additionally, monitoring for any signs of infection, such as increased redness, swelling, or discharge, is key. If you notice any prolonged skin changes or suspect an infection, it's essential to seek medical advice. A healthcare provider can help address the issue before it worsens, ensuring proper treatment and preventing complications related to diabetes. Sign number 11. Eruptive xanthomatosis. Eruptive xanthomatosis is a rare but noticeable skin condition that can occur in people with uncontrolled diabetes. It typically presents as red, itchy lesions with yellow centers, often appearing on areas such as the thighs, elbows, knees, and other parts of the body. These lesions are caused by the accumulation of fat under the skin due to high cholesterol levels, which is often seen in individuals with poorly managed diabetes. While the condition itself isn't dangerous, it's a clear sign that blood sugar and cholesterol levels are not being properly controlled. If you notice these red, yellow-centered lesions on your skin, it's important to seek medical advice. A healthcare provider can help assess your blood sugar and cholesterol levels, recommend treatments to improve your skin's appearance, and guide you on how to better manage your diabetes. Addressing the underlying issue of uncontrolled blood sugar is crucial in preventing further outbreaks of eruptive xanthomatosis and other related complications. To wrap up, we've covered 11 common skin signs associated with diabetes, from dry and itchy skin to more serious conditions like eruptive xanthomatosis. Recognizing these signs early can help with better managing your diabetes and preventing complications. It's important to monitor your skin regularly, and if you notice any unusual changes, don't hesitate to consult with a healthcare provider. We'd love to hear from you. If you have any personal tips or experiences managing skin conditions related to diabetes, feel free to share them in the comments section below. Your insight could be helpful to others in the community. If you found this video informative, please give it a like, share it with others who may benefit, and subscribe to our channel for more health tips. Thanks for watching, and take care of your skin. It's an important part of your overall health.